All right, welcome to week 7 of our crisis response conversations. The state library started these back when everything blew
7 weeks
with
ago.
this closure virus situation. And you've given us very good response to these, so we're continuing them. And today we are talking about reopening. This has been on everyone's mind at least for a week or more now. And I'm Mary Ann Morey. I'm the district consultant for Central District, and with me is Bonnie McEwen. And Bonnie's in Northwest District. Bonnie, you want to say anything?
Hi, everybody. I'll be back with you shortly.
Yep. So this, as all of our crisis conversations are set up, we do about 30 minutes of instruction and information, and then 30 minutes of open forum where you can ask additional questions and share information. So we're going to get started because we have a lot to share today. We first of all want to tell you what we will not be doing today. We will not tell you when to reopen. That is not our role. The state library is not a regulatory agency. The reopening of your library is a local decision. We will also not be giving you a prescription for reopening. So the information we're sharing here, it's just some ideas and examples for you and your board and your city to consider as you develop reopening plans and processes. And as sad as we are to tell you this, we cannot relieve all your worries. We wish we had a playbook. We wish we had definitive answers. We wish we had dates to offer you. We don't, and neither does anyone else. So as I said, what we are doing is providing you some examples, and here is what we are doing. We're going to review some considerations. We've already shared those with you a week or a couple weeks ago now. As I said, showing some examples. We will have plenty of time for your comments and questions. You can post those in the chat at any time. We will probably wait and address those in the second half hour, but go ahead and post them because we will be keeping track of that. And Sam, if you don't mind helping to keep track of that, that would be great. And we also have some resources that we'll be sharing with you after the fact, referencing during the session and sharing after the fact. One thing that I've been sharing with every librarian and trustee who contacts me, and I think my colleagues are sharing the same information in their districts, you must be in good communication with your board, your city, your county health department, and in many instances, your city attorney as you are developing these reopening plans. So if you haven't had good relationships or communication with your city and board and et cetera, and now is a good time to start developing those relationships because this really has to be a collaborative effort. The state library has been providing a lot of information, and I quickly wanted to show you how you can find that information because there's a lot of it there. And it's, I don't want to say it's hidden on our website, but you have to know the path to take. So if you go to our homepage, over here in the features, you see the little virus icon, and it's coronavirus guidance for Iowa libraries. If you click on that, that will take you to a page that looks like this. And that top line in the red says view the COVID-19 in libraries webpage, blah, blah, blah. If you click that link, that hyperlink of COVID-19 in libraries webpage, right there, it will take you to this page, and that is all of the information that we have been sharing since back on March 13th, I believe, 12th or 13th was the date, through the most recent, which was April 27th, and that was our list of considerations for you to look at prior to reopening. This date coincided with the day that Governor Reynolds did say that libraries could reopen. If you have not yet looked at this information, the considerations, and there are a lot of them, it took me 4 screenshots to fit them on this slide. If you've not looked at these, if you've not shared these with your board and your city, you need to do that first and foremost. There are a lot of things to consider, and I've had library directors contact me and thank me that the state library offered this because they said their boards were just, hey, we can reopen, fling open the doors and let everybody in. And many of them, and or a city administrator was saying that, or the public is saying that, and they said a lot of these people did not realize the huge number of considerations that have to be carefully examined and answered before you can actually start to reopen. So this is the first step in all of this. I did want to share the governor's proclamation, and we will be referring to this throughout the session today because there are several things in it that Bonnie and I want to point out. The very first thing we want you to see is that the governor said you may reopen. She never said you must reopen. So keep that in mind. And we are not here in this session telling you that you must reopen. As I said, this is a local decision, and you need to examine those considerations, talk with your board, your city attorney, and consider whether or not you are going to reopen. So with that little proviso, let's move on. Most of the plans that we're seeing are phased reopenings. Very few libraries, actually none that I know of, have returned to business as usual. Many of them have reopened, but they have some limitations. And these are just some of the limitations. And perhaps you've already looked at some plans from other libraries. And if you have, you can see that they often will begin with a very a phase 0, some are calling it, where the library really isn't completely open to the public. It's just, let's bring the staff back in and let's do some cleaning. They have limited circulation options, limiting areas, times. A lot of libraries are developing some special policies and increasing the age at which they will not allow unintended children. Typically, meeting rooms aren't being used. And then gradually, as you move through those phases, you end up with the extended hour services and hopefully eventually to a return to normalcy. This type of phased reopening is actually a method of project management. And I've already had 2 of my director roundtables in my district, with the 3rd one tomorrow, but the other districts are hosting their director roundtables later this month. And our CE theme for the year is project management. So I have this particular slide in my director roundtables because as we're talking about project management, that's a huge thing that you're doing with reopening. It is a project to be managed. And this particular concept of project management is known as the initiation method. It's also called waterfall method. And you can see this little triangle in the middle where you plan and design, and then you execute it, but you're constantly monitoring and controlling it as you're executing it. And in many cases, you're going to return to planning and designing. And I want you to keep that in mind, that as you reopen, you're probably going to be in this triangle for a very long time, where you're always monitoring and always going back and replanning and redesigning. So just keep that in mind, that flexibility is key in all of this if you haven't learned that lesson yet. So as while Bonnie and I were putting these slides and concepts together, these were the areas that we saw as areas to review. So we're going to quickly rush through these, cover these. I wouldn't say rush, but we're going to quickly, succinctly go through these areas so that you can have some examples to follow. And the first one is cleaning and safety. I know Bonnie and I both, and I'm sure our other colleagues in the other districts can say this, that one of the primary concerns for our librarians is reopening too quickly without having the proper equipment and supplies to be able to safely clean and disinfect things. And maybe many of you are facing the same struggles. You can't find any of these cleaning products, and you're wondering about a supplier. Anybody having that issue can raise your hand or post it in the chat. This has been a big topic in my district roundtables. I see a lot of you raising your hands. Yeah, struggling with that. So what do? You think outside the box. I just discovered this on Monday. This is right here in Swisher, Iowa, and I've heard others doing it. It's a distillery, and they're taking their alcohol, which this particular one is 80% alcohol. I guess maybe that's 80% proof. I'm not sure. Just don't drink it. But they are creating hand sanitizer. You can also make your own hand sanitizer. Surely you've seen this posted in areas, from rubbing alcohol and aloe vera, but rubbing alcohol is also in short supply. You might check with your city to see if they maybe have a surplus among some of the other departments that perhaps are not as open to the public as what a library would be, and maybe they can help share some supplies. Talk to your city to see if they have a vendor that maybe you haven't previously been using, and now you can latch on to who they're using to get some of these supplies. And if you have additional suggestions and ideas, post those in the chat. And then, of course, along with that safety is the whole personal protective equipment, the PPE for your employees. Do you have face masks? And if you're going to expect staff to wear them, are you going to provide those, or will you have staff bring their own? And if they bring their own, will you have some type of a dress code requirement? Because that one mask there on the right, you may not want your staff wearing when you greet the public. I love the bottom two masks with the books on them. Those were originally on Amazon, but when you look for them now, it says no longer available. The page is completely gone. So I'm not sure what happened to those, but how cool if you can get those. There's been a lot of discussion that I've seen in different forums and such, saying that gloves may not be as useful as you think because they do get contaminated and you're possibly better off just washing your bare hands regularly. This is why you need to be talking with your local health department or health experts in your area for information about best practices. A lot of people tied in with this are questioning, should we require the public to wear face masks? And we are not going to go into that because Mandy Easter, our law librarian, has covered that topic quite extensively on Library Talk. You can search for it with this topic of the thread, or contact your district consultant if you have trouble finding that. Just keep in mind that if you do enforce that, in a nutshell, she says your city should be passing that policy, not the individual library. And you also need to consider, what are you going to do if somebody says, no, I'm not going to wear a mask? Bonnie, I'm going to let you talk about this one.
Yes, well, this is an entire room sanitizer. And if any of you are using these at your libraries, please let us know your experience. I understand that Sioux City Public Library is about to purchase one. There are a few makes and models of these. There are a few companies that make these. They are also, I have to say, truth in advertising, a few $1,000s. So there's that, the high-end models. But, you know, maybe you could consider writing a grant from your county foundation. Maybe this would make a very unique and appreciative fundraiser for the Friends group to provide. Maybe this could be a gift from your library foundation. Maybe if you're in communication with your other city departments, who knows, maybe other city departments already own one. Another good reason to communicate and converse with your partners in the city.
Right. And I imagine a lot of you got this in an email yesterday from every library. And in fact, just this morning, someone posted on Library Talk asking about this, and that's the UV light sanitizer kind of thing. There was a post on Library Talk a couple of weeks ago about using UV lights for disinfecting books, and a couple of directors had done some research on it, and one in particular, I'm going to give him a shout out. Daryl, the director at West Des Moines, had done some very extensive research on this topic, and he shared what he had learned on Library Talk. So I think that would be worth reading before you invest in something like this. And if you, again, have trouble finding that on Library Talk, just contact one of us and we'll help you. Going back to the governor's proclamation, a question that I have had asked is, what is the extent of the library's responsibility to help people avoid this virus and to ensure cleanliness? If you look at the governor's proclamation, it talks about reasonable measures. Reasonable measures. You're supposed to have increased hygiene practices, so certainly different than what you probably used to do. I doubt if you were in the habit previously of wiping off every doorknob and every book and the things that many of our libraries are planning to do or are already doing. The other fact is that you have to have 50% of your legal occupancy capacity. So reasonable measures within these constraints, something to consider. That 50%. The next question that we consultants have been fielding is, I don't know what my capacity is of my building. Contact your city hall. They should have this on file. In fact, one of our colleagues discovered that there's a state mandate that says this is supposed to be on file with your city. So check with your city hall. Other places that might have it would be your insurance provider, your architect if your building is new enough. Check with the state fire marshal's office, but I imagine they're being swamped right now with requests. But keep in mind that this is not your total square footage. This is of your open space. You have to take into account work areas and desks and shelving and things like that, that's not occupiable space. So whatever the occupiable space is, it's only 50% of that. I had a director in my roundtable yesterday that I think it was the roundtable. Anyway, she was in one of my meetings. She is a larger size library, I think a G size library. It has a very big open library. And she was shocked to learn that her available capacity for people inside the building was roughly 170 people. And she thought it was much more than that because it's such a big library. So half of that, less her staff, is a very small number, much smaller than she anticipated. So I tell you that story just to say your capacity is probably much lower than what you anticipate. So how do you keep track of how many people you have in the library? Well, here's a solution out of Germany. We told you in our CE description we were going to talk about worldwide libraries. So here's our example. Germany, they're kind of going the Target route. They are going to have a designated number of shopping baskets. So for ease of illustration, let's just say 10 is your maximum that you can have in the building at any one time. So they have 10 baskets. And every person that comes into the building, they give them a basket. And when the baskets are gone, you know that you can't let any more people in the building. And as people leave, they return their basket, and you can see you've got 2 baskets returned. That means you can let 2 more people in. I think the cons of this, I mean, the pro is obviously it's very easy. The con is you probably don't have baskets, and they may be hard to find, and or they're pricey, and or it's going to take time to get them. You would also have to disinfect the baskets every time one is returned. And depending on what services you're planning to offer when you reopen, it's quite possible that not everybody entering the library needs a basket and they don't want to have to drag it around. So what would be another option? A ticketing machine. No need to disinfect these. It's easy to use. The con is it's probably even more expensive than your baskets, and you're going to have little bits of paper all over the place. Another option, the red Solo cups or something like it. You wouldn't have to disinfect these necessarily if you had to stay shove them, but again, it's something for the customer to have to carry around. So here's an option I thought of. Take pens or whatever you have at your library and have a table, and on the left side is the number of people who can be admitted, and on the right side is the number of people already in the building. And as people come in, you have somebody staffing this table. They take the pen from the left side and they move it to the right, and another person comes in and you do the same. So you can easily see from this graph, you got 6 people in the building, you can let 4 more in. And when somebody leaves the building, you take the pen from the right side and you put it back on the left. It could be a very easy thing to do, and it's using something you already have available. The downside is you'd probably need somebody to staff this table. Hours of operation. Bonnie, I just had this question in my director's roundtable this morning asking, are you reducing your hours? Again, show of hands, how many of you are planning to have reduced hours when you reopen? Several of you raising your hands.
We've talked about this as well at our Northwest office hours, and many Northwest libraries are considering this maybe opening in the afternoons so that the staff can be there in the mornings to do some housekeeping and house cleaning.
Right. I think this is probably what we're going to see at a large number of our libraries. This is an example, not from here in Iowa, but they have this front and center on their web page. And I think that when you do develop some reduced hours, you do need to make sure your public is well aware of that. So do have that front and center on your web page and all of your social media, and of course on the front door. One thing that I've been talking about with the librarians to inquire is what to do with your collections and circulation. And I have said, I don't think I would, at least in the beginning when you reopen, I don't think I would make your collection browsable. If the whole premise is to limit the number of people there and to limit the amount of time they're in the library, one way to help deter people from loitering and hanging out at the library is to just close off your library proper, the collection. Now, some of our library floor plans are obviously better suited for this than others. If you have a lobby area and your circ desk is right up front, it would be very easy to just block off the rest of the library, turn out the lights and block it off somehow. I don't know if any of you are considering this or not. This might mean that you would have to continue with the call-ins or the online reservations for materials. People would have to know what they want before they come to the library, or at the very least, they would ask you, I need some books on rocks when they come to the library, and you go into the collection and get them those books and bring them to them. One question that was asked when I was talking about this in office hours, well, what about our new books? Everybody wants to browse through our new books. I would put them on a table or a portable shelf like this one and have them front facing toward the front so people can see them very quickly when they first come into the library. They can kind of grab and go, and you could set up something like this to block the rest of the library. As you have undoubtedly heard, and maybe some of you are already doing this, and just raise your hand or post in the chat if you're doing this or have done this, curbside delivery. All of these curbside examples involve having patrons pre-order the materials. It involves staff going and getting the items, checking them out, bagging them, sometimes disinfecting them, putting them in a bag, and then either putting them on a table outside or now perhaps just inside your lobby and giving an appointed pickup time for the customer. This is very much like what the groceries are doing. In fact, my husband just picked up an order from Sam's today. He had a designated time and we placed the order online, and it was a convenient way for him to be able to get the items that we needed without him having to really venture too much into the store. So variations of this would include the patron parking on the lot and then calling you when they arrive after they've already been notified that their order is ready. And a staffer would deliver the books to the car or just put them near the car so there's no contact. This would definitely be an aspect of a phased reopening. If you haven't been doing curbside, perhaps you start it as an early phase of your reopening. If you've been doing curbside, maybe you move it into the lobby as an advanced part of your reopening. Bonnie, this came out of your district, so tell us a little bit about these sneeze guards.
Yes, photo is thanks to Glenda Mulder from the Lorenz Library. Glenda sent me this picture of how they have set up their circulation desk with a plexiglass shield. In fact, this now is a very hot topic popping on Library Talk right now. At Lorenz, they have now set up 2 spaces like this, where in one space people will go to check out their materials. In another space is where they will return their materials. So the slide here shows some of those sources for plexiglass shields, and really there are a surprising number of places that we have discovered, and thanks to your conversations, you've shared some as well. Office supply stores have been a popular place to go. Custodial supply stores as well. Lumber yards, sign design companies, and just this week on Library Talk, a lot of you have been commenting that your city works departments or your other city maintenance departments are willing and able to provide these kinds of shields for the library. So yet another good reason to communicate with your other city departments about what the library may need to set up.
I like this example from your library because it does have the cutout at the bottom so you can slide materials through, and it has checkout clearly written at the top. So it's an attractive piece. It's not just this clunky piece of plastic in front of somebody's face. It's well done. And you can see too that it's portable the way it's designed. I think it's a nice feature because I know a lot of people don't want to have to drill holes into their cert desk to mount some plastics. So if you can get a portable option, that's a good one. Some of you may have a self-checkout station, or some of you might be contemplating that. Self-checkouts typically require the person to touch the machine, either a keyboard or a scanner or the screen. And if that's the situation, you need to think about how will we keep this disinfected? Will we disinfect it after each and every single use? Will we have hand sanitizer next to it? Some considerations. One of my librarians in Central District, and that's Roxy Young from the Montgomery Library in Jewell, Iowa, which is in Hamilton County, she has a brilliant idea that I have been repeatedly sharing, and she graciously sent some photos to me because I said, could you kind of show me how you got this set up? And so she used one of her own children. This was not a member of the public being put at risk. She took her library scanner, which thankfully already had a long cord and is in a stand, and she put it on a table 6 feet or more away from her. And she will still have to be at the desk to see that the information gets logged in correctly. But patrons can then scan their own library card and scan their own items. They don't have to touch the scanner. She doesn't have to touch the items. It seems like a really easy, inexpensive, doable way of conducting circulation at the desk. So feel free to mimic what Roxy is planning to do there. A lot of resources I'm reading, they encourage you not to be circulating your newspapers and magazines because there's really no way to disinfect them, and it encourages people to sit and browse. I imagine you all have your newspaper readers who come in every day. So that's something for you to consider, and that we are seeing in some of the plans that are being developed. Moving on to computers and furnishings, I think a lot of libraries are planning to move out or make unavailable their soft seating and most all of their chairs, with the exception maybe 1 or 2 for people who can't stand for a length of time while you would check out their books. For the most part, you're removing things that would encourage loitering, for lack of a better word. Bonnie, this is another good example out of your district.
Yes, this again is thanks to Glenda at Lorenz Library. It's a look at how they're social distancing their computers. So I like what they've done here by turning every other computer backwards, and you can see that they've also removed the chair that's typically there as a way to, you know, again, send that message that people need to keep farther apart than normal. And I've heard of other libraries who are doing something similar when they have public computers arranged in a long line, or maybe in an L shape. They may be throwing some kind of covering over every other computer. I've also heard from several libraries that they plan to limit the amount of time that people would typically have on a library public computer. If people typically had 90 minutes, they might be down to an hour. If they typically had an hour, maybe they're down to 30 or 40 minutes. So that's another way to keep people and the equipment a bit more apart.
Yeah, I've heard from some libraries that are planning to take appointments for computer use. Keep in mind that since you are required to be at 50% of your capacity, if you want to ensure that as many people as possible can utilize the library as they have needs, you don't want the same people coming in and staying for half the day. So this is one way that you can help ensure that the correct number of people can be in the library, and that multiple people from your community can use your resources. On the topic of computers, you obviously don't want to be assisting patrons this closely like you used to. I just heard in my director roundtable this morning that one of the libraries is planning to get face shields for the employees to wear, so that when they do have to get a little closer than 6 feet to help with something, they at least have a face shield on. Another library, Sarah, I think you're in the room, from Marshalltown, her city is getting something like this. Some of you might be familiar with TeamViewer. We use it here at the State Library. It's a way that your library resources technician can access your computer and I hate to say take control of it, but that's basically they can get onto your monitor and see what you're doing and help you in that way. So some libraries are contemplating this, that they could help from a further distance with somebody who's struggling with a computer.
Hey,
Going back. Oh, go ahead.
I want to interject a little bit about TeamViewer, just real quick. I would say
Jay,
it's
this is
very.
Sam. Could you get a little closer to your microphone, please?
Sorry, I'm right on top of it. I don't know what's going on there. Better now?
For me, yes. Thank you.
I just want to say with TeamViewer, be forewarned that if you're sharing a network with those computers, it can be very hard to use TeamViewer that way. It would work very well for, you know, if someone brought their own device, that's an excellent idea. but we have no shortage of issues trying to use that in a same network. So maybe they've got that a workaround, but that used to be the way it was a few years ago. Thanks.
Okay, thanks. And I'm sure our LRTs would be able to help you if you had any questions you wanted to know before you purchase the product, some ins and outs about it. Going back to the governor's proclamation here, you are supposed to ensure social distancing of employees and patrons. And one way you can do this is through signage and messaging. And Bonnie, you found some good examples here.
Yes. I came upon these posters from the CDC, and I'm sure all of you, like I have, spent some time on the CDC website following their tips for health and wellness, but they also have a variety of graphics and posters that are available to download. You know, we all hope that the coronavirus does not make a reappearance this fall and winter. We're all hoping for that. We can probably be assured that the flu season will roll around again, though, as it always does. So you'll see the poster on the left is not specific to the coronavirus. This is a great source for you to freshen up this kind of signage that can go in the library's restrooms. The poster on the right does speak to COVID-19, but the other one doesn't. Both of them would be very very good new posters and flyers to add to your library, and for very little effort and certainly nothing that has to happen of your own design.
Bonnie, did you check on a price coming from the CDC? I would guess these are free or inexpensive or printable on your own, or?
I believe they to be free and printable. I will definitely look at that before we finish today. Yeah. And while I'm thinking about it, Marianne, I also wanted to come back just for a minute about those plastic face shields and give a shout out to Cherokee Public Library. And I think I've heard of others in Iowa that are doing likewise. Cherokee Library is using its printer, its digital printer, tell me.
3D printer.
Thank you. 3D printer. The name wasn't coming to me. They're using their 3D printer to make plastic face shields. So what a wonderful contribution to all of this. And I wanted to mention that. The next slide is another great way for you guys to freshen up some of your flyers. And again, you know, really easy to do. These I found at the U.S. Chamber of Commerce, and in both cases, the flyers on the left and right are customizable. When you go to their website, you can find these flyers, and it's like a fill in the blank with your own library-specific message, and then you can print both or either version of this. They would look just like you see on the screen, very nicely, professionally produced, and it's sure to save you some time as you think about messaging and signage in your library to relate to these safety precautions.
Yeah, we imagine you all have plenty of things to worry about without having to design something like this. So take advantage of these sources that already exist.
And here are just a couple of more ideas for you for signage. I really loved that exterior floor mat, please practice social distancing. Now that one you see on the screen comes from the Janway Company, not that we're doing a commercial for them, and there are many other companies where you could find similar products, but I think that's really a great idea. And from Amazon comes all of these directional signs. If you've seen these in grocery stores now have set out one-way directional signs up and down their aisles. They also have those floor decals that suggest that people stand right here and wait for the next available clerk. There are a lot of these options available at Amazon. So check them out there, and maybe you have since found some of your own sources that you can share.
Yeah, and I would say if you have a local sign company, check there to give some business locally, but maybe share an example that you've seen elsewhere, such as what we're sharing here, and see if they can't fix you up with something. Just a few more ideas and resources, and go ahead and type any of your questions in the chat box so we can keep track of those and address those when we do the open plan. Bonnie, this was something you wanted to share, so this is a good example of collaboration here.
It is. Yes, it is. Nothing about this experience has been easy for any of us, whether you think of it personally or psychologically or professionally, nothing about this has been easy. But I have been of the opinion that maybe some of the decisions that our libraries have to make might have been a bit easier and may still be a bit easier if those decisions can be made in coordination with other likely partners, with other city partners or business partners, maybe just with stronger, improved communication. So if I would love to think that the city administrators would coordinate Zoom meetings for all their city workers and city departments so they can talk about these kinds of issues. But if you can talk to your city administrators, your mayors, certainly bring the library boards in on these conversations. And how about other businesses in your town that might see some of the same foot traffic that public libraries see? See, I think it's a very different proposition for the city hall to open again for business and welcome in the occasional visitors. It's a different proposition for what our city libraries are facing. And so just improved communication. I have been saying this for quite some time, so imagine how tickled I was when Cynthia from Cresco Library shared that they are doing just that. Cresco is looking at a May 18th opening. They have had meetings with the city clerk, the library, the Department of Health, the public school, and the local fitness center. Those are all such logical partners to talk to about reopening. So this is just my encouragement for you to share your plans and what you intend to do with your colleagues in city government and in business.
You make a good point, Bonnie, talking about let's look at some, maybe even if we aren't able to partner with them, let's look at what some of these other businesses are doing that have been opened. Local bike shops, for an example, they've been open? They've been allowed to stay open because they're considered transportation. What have they been doing as safety features? What has your grocery store been doing as safety features? The fitness centers, like you said, what are they contemplating? Because they typically have a lot of people coming in. So those are really good places to go to get some additional examples and some partnership ideas, at least. We do have some reopening planning documents that we are going to have as PDFs available for you when we make the slides available. And one got left off here because I just received it this morning. I had a director's roundtable this morning that ended 30 minutes before this session started, and I didn't get a chance to add it to the slides. But you can see we have Eldora, Lawrence, Bertha Bartlett from Story City, Sioux City, Mitchellville, and I'm adding Waukee. These are all very good plans, slightly different, yet slightly similar. The one from Waukee that I just received this morning, I have to give Christine, the director, a shout out. I think it's one of the best I've seen as far as not just the ideas, but the format is so readable. And it includes concerns and supplies that might be needed for each of the phases. So we will be sharing these as PDFs, and we recommend you look at all of these, as well as maybe others that you've come across, and consider some of the ideas from these other libraries. These are all various sized libraries, from very small to very large and everything in between. So we think you'll get some good ideas from these. I think an important thing to consider, going back to that concept about project management of your reopening, is evaluation. You've got to evaluate regularly. I would say daily, even if you're a single solo librarian, daily review what worked and what didn't work, and communicate with your board and with your city what's going on. And I would say you need to be in good communication with your public too. so that they know what to expect and they understand what's going on. Keep up with the governor's announcements, with the state library information. And if your plan isn't going well, or if your area suffers a relapse, revise your actions or back up to an earlier phase, which is the advantage of having a phased and clearly outlined different phases so that you can advance forward when it's the right time, but you can also maybe back up if the situation calls for it. Some additional sources. Bonnie, you gathered these. You want to just talk briefly about these and we'll open up the floor.
Sure. We've been compiling, as Marianne has said, and shown you so many resources on the State Library's website. And if you visited the CDC website, you'll find information there as well, the Iowa coronavirus website. So we didn't want to repeat all of that here. We just wanted to use this slide to remind you where to go to find some more answers. The two I will point to is a fairly recent article from Library Journal that came out in early April about the safe handling of paper in these times. And since libraries are paper-based for the most part, that might be a good article you would want to read. And the very top one there from Iowa Homeland Security, every county has an emergency management office. And we've learned that those county emergency management offices will often have sanitizers and other supplies available. So just go on the web, contact your county emergency management office just to inquire if that could be a likely source for you. You all have been chiming in with the sources where you've been finding masks and gloves and sanitizers, but this is just one more place to check.
And as always, if you have any questions anywhere along the way, if you are feeling overwhelmed and you need a sounding board, call your district consultant. We are here to help, and we all know how to listen. We can meet you face to face in a Zoom room. We can talk on the phone, but I've been telling my directors, don't hesitate to contact me. So with that, if I can get my mouse manipulated back over to my other screen, I will stop sharing. And I haven't been able to keep up with the chat since I was presenting from my screen. So Samantha, were there questions that came in that we can cover now, or if you have one or want to offer a suggestion, now's the time.
With the chat was a full-time job. I have copied and pasted questions out of the chat into a text document. So I'm going to go through some of those now, and I might start with just a quick one, Marianne. There were a few people who missed how you are sharing the sample reopening plans that you have.
Those will be shared as PDF that we'll have available when we post the recording of this, and we'll have the slides available as well as PDFs of these plans.
Okay, so those will be coming. We should have the recording up in the next couple days. This next one I want to, I don't know if Mandy is on, or this might be one we have to take offline, but there are a few questions on like legal questions about how you can restrict who's in your building. So would there be any legal implication to limiting the first hour, for example, to high risk or vulnerable populations?
I think this would come under a board consideration as a policy. And as I said from the get-go, you need to be involving your city attorney with some of the policies you might be establishing, just to ensure that you won't have any issues. For instance, one of my libraries, the director said their city attorney was willing to back them up if they mandated masks for the public. And if you've read the information we've shared, we said that you could be very liable if somebody were to challenge that. But if your city attorney is willing to back you up, you know, who are we to tell you what your city attorney can't do? But yeah, I would run something like that past your city attorney. I think in these times, a lot of people are familiar with the special hours, and many of our libraries are currently doing special hours for example, autism children. So that might be something to use as a precedent. Bonnie, do you have
Okay.
anything else to add to that? And I would definitely contact Mandy first for information, and then go to your city attorney for advice. But Bonnie, do you have anything to add to that?
Well, yesterday at our Northwest office hours, we talked about people in the building, the number of people versus the ages of people. And our conclusion, I think all of us felt the same way. We just didn't want to go down the road of looking at the people coming in terms of their ages. Just look at the numbers of people coming in and worry less about their ages. It seemed goofy to us to think that a 16-year-old could drive his parents to the library and drop them off at the curb, but not himself be able to go in and check out a book. I mean, that doesn't seem very logical or very enforceable, and I would be very leery if I were a director of doing that.
Also,
So think about numbers rather than ages was our conclusion.
Yeah,
and
this is
also keep in mind that Mandy has often said that, and I just lost my train of thought. It was on somebody that had something going by there. But that you may be putting yourself into a vulnerable position. As somebody said, well, I have to pay my attorney every time I contact him. And Mandy will say, it's much better to pay for an hour's worth of attorney time now than to pay for hours and hours and hours of attorney time after some litigation arises.
Hi, and this is Angie. Hi, everybody. I want to address the children and teen question briefly for a minute. And one of the things I want to say is I want to really stress that you need to look at what your policy is going to be for everybody. So if you have a policy that says we are only taking appointments for computer use and you only get 30 minutes a day, you need to apply that to an 8-year-old the same way you would for an 87-year-old. So I think that what that needs to be based on is policy, that not age. So you need to not say 10-year-olds can't be on the computer at all. You need to say everybody can only be on the computer for 20 minutes. It is what it is. I'm sorry that you can't be here for 4.5 hours to do your resume, and I'm sorry you can't be here for 4.5 hours to do Minecraft, but because we're limiting how many people can be at the building at one time, this is the rule. So tied to what Bonnie was saying, I think you need to take it out of age and keep it into policy. 10 people can be in the building, 4 people can be on the computers, doesn't matter what their ages are. So that's my
And I would agree completely with that too. I
Cool.
shared this story in one of my roundtables that one of my daughters is a single mom, and she has a 12-year-old who is very short for his age and has a baby face, and he looks like he's closer to 8. But he's very well behaved, and he is 12. And she went to a local store that is a national chain, and they have a policy that no one under 16 can go in the store. And they had a bouncer at the door and told her, no, you can't come in with that kid. Her child felt very belittled. She was upset. She took her business elsewhere. So, how do you balance? And I think this is the great question, that balancing of protection versus fair treatment. There's a very fine line between precaution and paranoia. And I honestly don't know where the crossing comes. But the tough decisions, as we've all said, and there are no easy answers and no playbook.
There have also been several questions about restrooms. So can you limit public restrooms? Are you keeping restrooms open? Let's transition and talk a little bit about that.
That's one I would definitely go to my city attorney with.
I think bathrooms also are really determined on cleaning products. So, that takes us back to the original supply of what cleaning supplies you have. So that again is another thing to talk about with, how are you going to allocate the supplies?
I see that Becky in the chat, I'm going to assume that's Becky Heil, but I'm not sure. Becky says, I did talk to a city attorney yesterday about this. I'm not sure if you're talking about the age limits or the bathroom issue, but if you want to elaborate on that, please feel free to put it in the chat or open your mic and do so.
Okay, I just opened my mic. Yes, this is Becky Heil, and I did have all 3 of those questions that I sent to Mandy last week, and she was going to work on the bathroom issue as well as the separate hours for groups of people issue. and get some information for that. The question that I had yesterday, it was actually a question to me from a city attorney, was about some of the recommendations that we were making. And so I gave him that information. And I don't know if I can say this absolutely how he said it, but when he talked, because they are considering limiting to certain hours for certain age groups. And so he said it's always easier to make it less than it is more. Oh, shoot, I'm not getting that right. But basically, he felt like that was probably an okay thing to do if you had times for everyone involved in there. But again, the exact same things you said, and that is you have to figure out who's going to be the bouncers. Are you really going to call your police officers to kick somebody out, you know, a senior that came during the teenager time? So that was one of his questions that he was dealing with. But I'm hoping we get information from Mandy about that.
One thing that as a consultant I tell people under normal circumstances when I do board training is boards need to be careful of establishing policies that cannot be effectively enforced. And the example I use is saying nobody under 12 can be on the internet. Well, can you really enforce that? Are you going to card people when they come through the library? Are you going to take the smartphones away from every young person who walks in because that smartphone may, by default, access your library's internet? You can't enforce that, so don't make that kind of policy. So I think the same consideration goes here. Are you able to enforce the policies that you may enact? And you need to answer that question before you develop a policy. And again, go to your city attorney for the best advice about this.
This is Nancy too. I just want to interject. If you want to do the special times for the vulnerable or different groups of people, make sure you really understand that you won't be able to tell that people are vulnerable. You can't ask them because that's HIPAA. So it, you know, all vulnerabilities are not visible to the eye.
Very true.
So just a heads up on that one.
Samantha, other questions that came through earlier?
Yeah, there were. I'm gonna make sure we save the chat from this session because there's a lot of questions like where do you buy gloves, where should I get this or that, and a lot of folks stepped up and answered those questions in the chat. So we'll make sure that gets posted and sent out as well. There was a question if anyone has an example or is currently hanging up a sign that says something like, is there any, like, there's no guarantee that this place is germ-free kind of thing. And there's also questions about, can you remove somebody who's sneezing or coughing? Or, you know, what should you do if a patron is maybe asks, you know, that guy over there is sneezing, can you kick him out? That sort of thing. So I don't know if we want to take a minute to talk about those kinds of topics here.
I will say that Mandy has addressed the issue of can I kick out somebody from the library who seems sick? She's previously answered that. I believe that's in library, on the library law FAQ. Basically she says, you know, you probably shouldn't be doing that. Again, I would talk with her. I would check with my city attorney. From what Becky has indicated, she has already contacted Mandy about answering some questions. So I imagine Mandy is going to have a forthcoming legal tickle filer coming your way. Regarding a sign on the front door, I just talked about this in the director roundtable I had this morning. I said, I don't think it hurts to put something on your front door and on your webpage that says the library, per the governor's proclamation, and I highlighted that earlier, we are doing our best to follow reasonable precautions. I think, I don't remember the exact verbiage, but I highlighted it on that one slide. Reasonable measures, I think it was, to ensure that we are maintaining a clean facility, but you do basically enter at your own risk. You know, I'm not sure I'd put enter at your own risk on the front door, but to that effect, there is some personal responsibility for entering. But do let the library, the public know that you are doing reasonable accommodations. And I don't think anywhere that a reasonable accommodation guarantees germ-free. I don't think you can possibly do that. You know, that's obviously not something you can do. So talk with your city attorney again.
There's another question kind of related to staff and wellness, or maybe this from Sarah is about all patrons as well as staff. A staff member visited a doctor. They were asked 4 questions and did a temperature check before they were allowed in for their appointment. Is this something we have to / should do? I see Bonnie shaking her head.
Bonnie, go ahead.
No, I think that is gone a bit beyond reasonable accommodations for staff to attempt to be to take people's temperatures and to interpret those temperatures and to stand in lieu of healthcare workers. I would not advise a library staff to do that if I were a library director.
That's very much like what Mandy has said previously about that, of trying to put yourself in the place of a healthcare professional. I had a library contact me recently that said someone from the city was kind of implying that every person walking through the library door should have their temperature taken. Not just employees, but the public. I said, you might want to talk with your city attorney about that. So I don't think that falls under a reasonable measure like Bonnie was saying, but
there's a
keep in
question
mind
about if staff members are ill now. I think this is a change with the COVID situation that you can ask staff members to leave if they are showing signs of symptoms. Is that correct? That's what I remember from our presentation with Mandy.
Yeah, I think you have a different control over your staff than you do over the public, and you do want to try to ensure that the public is safe, so you obviously don't want sick staff there, coughing all over everything.
And if a staff member is in a vulnerable population.
And Bonnie, you may want to address this too, but I've been telling my librarians, if you have an employee that way, if you can find a way for perhaps that employee to continue to work at home or to work in a back staff area, if you're fortunate enough to have that, or perhaps in an area of the library that you're closing off to the public now, and have them do your book ordering, your book processing, keep up with the online requests or the phone calls. That would be something that they could still be a valuable contributor as a team member, but not have to be right there on the front line. Bonnie, what have you been telling? I'm sure you've had that question.
Yes, I have, and I've been saying much the same. If you're able to maybe even temporarily reassign what had been other people's job duties and shift those job duties to another person who's feeling more vulnerable and maybe more susceptible to COVID, then absolutely try to do that.
I see somebody asked, can we limit 30-minute visits to the library? And as we talked about, and as Angie so eloquently addressed, make it for everybody. You're not just limiting the kids or the older people or the whoever group to 30 minutes. Everybody is limited to 30 minutes. And I think it's a fair temporary policy to enact because you're probably going to have limited hours. Most of you talked about having limited hours. And if you want to ensure that you can have people be able to come in, you don't want the same people staying there the whole day, as we said earlier. So having limited hours helps people to do what a very wonderful librarian in my district, who's in the room, but I'm not going to call her out, has basically said her policy is get your stuff and get out. But she's not putting that on the front door. But that's kind of what we want people to do. So
and this is Angie again, and I think the way to frame this is to say to the public, we want to serve as many of you as possible. We want to serve as many of you as possible, but to do that, we have to limit how long you can be here. And I think that this is a really hard thing, but I think that it's also the way to say, we understand, we miss you too. We wish that you could hang out here all day and read the newspaper and play with the toys, but we want to serve as many members of our community as possible. And to do that, we have to put these limitations on, which means we have to limit your computer time. We have to limit or remove your browsing. So I think that communicating to patrons that we're doing this, and if we don't do this, we can't serve you at all. So do you want us to be open? If you want us to be open, we have to limit you in this way. So I think putting it in terms like that helps patrons kind of try to understand the perspective.
yeah,
And I would like to come in with just one more theory or observation that has occurred to me in these past few weeks. And one of the reasons we wanted to display a slide with those libraries that have done phased in reopening plans. So my theory is this: I think because there is so much angst surrounding this moment we're living in, so much is being talked about, so much is being verbalized, which is really super helpful, which I think indicates why we've had such great turnout at these Wednesday conversations. But what I see happening is that not enough of what's being talked about and verbalized and shared with each other in conversation is actually being put to paper. Much of this that you're going to be deciding will be procedural. This needs to be written down. It needs to be put to paper so that your staff has a clear expectation of what is expected of them, and so that you have a written communication of what you can relay to your community as well. These reopenings are going to be procedural, and there are so many other procedures in the libraries, everything from book ordering to cataloging to conducting interlibrary loan to using the library's automation system. All of those other procedural things are written and documented. And so my urging would be, if you would start to put this to paper, then you can start to see how this starts to come to light in these various phases of reopening. And I think that will go a long way. I have to think there's no downside to that. It will go a long way toward relieving some of this anxiety.
Yeah, and I was going to say, and excellent, Bonnie, I completely agree with you, but you've got to be communicating to the public what your plan is and what their expectations are of coming to the library. And Angie is so good about making everything seem very positive. And I that's what I told some of the directors in my session. I can't remember if it was yesterday or this morning's, the roundtable, that instead of saying, well, we can't offer you this and we can't offer you that, and you also can't do this in the library, start to talk about, here's what we can do for you. We can give you 30 minutes of time on the computer a day. We can take a reservation for this. We can meet with you in Zoom. We can do, talk about the stuff you can do, which I think is better. Just as an aside here, I saw it fly by the chat. Somebody said the grab and go phrase is a good one, and that's a little more polite than the get your stuff and get out. I wanted to address the topic of touching. I don't know if that came in on the chat, but that was a big topic I've had in my roundtable yesterday and today. Somebody said, I don't want people coming in and touching everything. A local bike shop where I work part-time, they have a sign on the front door that says, during this time, we ask that you refrain from touching things. And yesterday when I worked there, I did notice that people were kind of walking through like this, keeping their hands to themselves. They weren't touching all the clothes on the racks and ringing all the bells on the wall like they usually do. So if you don't actually limit your browsing by closing off your collection, at least post a sign that says, please try to refrain from touching everything you see in the library.
Yeah, there have been several questions in chat. Should we do this? How can we do that? Does this make it clean? And the answer that I would recommend to all of you is that the state library are expert folks at being librarians, but we are not experts at viruses, unfortunately, most of us, any of us. And so do watch for those slides, and you'll have the links to the resources from the CDC and the American Library Association and others who do have much more in-depth resources. And so if we can help you, we want to, of course, but we do encourage you to kind of do some of that research as well and find what's going to work for your library and your community. We are coming up on time, and so we'll hang out here as long as people have questions and want to chat. We don't have it posted quite yet, but next week we are going to have another crisis response conversation on serving immigrant and refugee populations in your community during this time. So we'll make sure that a link to that gets in the recording gets in the email with our slides and link to the Survey Monkey. So be on the lookout for that in the next day or two. And like I said, we will hang out here as long as you can, as long as anybody needs to ask questions. We'll keep an eye on the chat. But I do want to acknowledge it's the top of the hour. So if anybody needs to leave, please do feel free to do that as well.
Did you want to go ahead and stop the recording?
Yeah, and I'll stop the recording. Actually, maybe I'll keep the recording on in case people ask more questions. We'll see.
I saw that Lola asked a question that came up in my roundtable today, and that was, what if I have an employee that for whatever reason, wants to continue working from home. And maybe it's not for health reasons. Maybe it's just they like wearing their pajamas all day. And we did discuss this in our roundtable. How are you going to help transition your staff back into the library now that they've finally gotten the swing of working from home? And in many cases, they perhaps like working from home. I think that's an issue you have to discuss with your city administrator, because that employee is a city employee. If you have an HR department, definitely talk with your HR department. You may need to talk with Iowa Workforce Development and perhaps your city attorney. And you, if you're the director, you may have a tough conversation to have with the employee. One of the directors, I don't know if she's here now. Jenny, are you in the audience? She did such a good job of talking about her phasing back in of the employees. And I think she had her whole staff kind of working on an alternating basis, alternating days. So she didn't have an abundance of people in the building at any one time, but that was kind of a compromise for getting people back in, and meeting with them regularly so they're seeing each other and knowing that they're still part of a team. Anybody else have ideas on that?
This is Nancy. I would certainly say it depends on the job. You know, there are some jobs in libraries that obviously don't lend themselves to working remotely, but then there might be some that could. So I definitely agree with Marianne and talk to your city if you have an HR person or your city mayor, city administrator, whoever fits that role within your town. Because there is a lot. I'm going to have trouble getting a lot of my staff back into the office. And I'm sure there's some of them on this call that are thinking, yeah, not me.
Nope, I want them ready to be back.
Julie's asking about how to keep the library from becoming the daycare since the schools, the parks, the pools are closed. And I think we've already addressed that by saying you'll probably have limited time that people can be in the building and only so many people at a time. So if you're treating those kids the way you're treating everybody else, sorry kiddos, your 15 minutes is over. You're out for the rest of the day. This is the same policy that everybody else is experiencing. And you'll avoid being the daycare center.
And this is Angie again. And again, first of all, equity across age. Why is nobody in here saying, I don't want to become the senior center? I don't want to become the senior center's closed. I don't want all the old people hanging out in here all day. First of all, there are a million times they might actually die from hanging out in the library, but nobody in here has said, I don't want to become the senior center. I don't want to have them all in here taking their coffee, taking up my space. So again, we're talking about equity across policy regardless of age. So 15 minutes is 15 minutes. Second of all, you need to also say, we're not saying we don't want to be the daycare you got to throw out. We're saying we want to serve 500 community members today. And that means everybody gets 15 minutes. It has nothing to do with you. It has nothing to do with you causing trouble. It has nothing to do with you making mischief. We want to serve 500 community members today. And the way we serve 500 community members is we make sure that everybody gets 15 minutes. You take your turn, next.
Yeah, I share the story, Angie, that I heard of when I was in an office supply store one day, and the guy that was helping me interrupted our session and got on his walkie-talkie and said, hey, Joe, a group of teens just entered the front door. They're heading to the back. Keep an eye on them. And I said, I wonder if he would have done the same thing if it had been a group of little old ladies that had entered. Hey, Joe, a group of little old ladies just entered. They're heading to the back. Keep an eye on them. You're right. Whatever
They're just as dangerous.
Yes, and just as noisy and rowdy too, aren't they? So
I was gonna say, we in regards to the staff returning to work thing, my library has had a policy for telecommuting from before this, because our building was condemned at one point and everybody had to work from home. And so one of the things that it states is that the employee must still be in good standing, must be in good standing, must have been present for 3 years or something like that, has been employed for 3 years, and then has to have permission from the director. So I really think that, we do have, I've talked to my staff about it before, and I've kind of been telling them, like, before this, if they were sick and they don't want to count it as a sick day, or they're part-time and don't get sick days and things like that, if they feel, they're just home with a headache and can't, or home with a fever but feel fine and can't don't want to spread it to everybody, it's better for them to work from home than it is for them to work at the library.
There was a question that came through earlier too, about advocating for sick leave for staff.
And Samantha, you're fading out.
Uh-oh, is that any better?
That's better, yeah.
Okay, there was a question that came through on chat earlier about how to advocate for sick leave for staff, since a lot of folks are being told if you have a sniffle, stay home, when that normally wouldn't be the case. Any will have thoughts on that? How can you be paid sick leave when we would normally, maybe it wouldn't be an issue as much?
I'm sorry, I saw something in the chat go by that caught my attention while you were talking, so I missed it. Bonnie, if you caught that, what she was saying and want to address that. I didn't really catch what the main question was.
The
Sam.
main question, I think, was that what do we do for our part-time staff who don't get sick leave, and if they are sick?
Yeah.
I mean, I think
Yeah.
that's a huge issue that every employer is going to have to be facing at this point.
Yeah, and that's been all the news. You don't work, you don't get paid, right? That's why people continue to go to work even when they are sick in normal conditions, and even now when they have symptoms that seem like it's a virus symptom. That's a tough one.
And there are still huge issues with the unemployment thing. If your building is, or if you do reopen and staff members don't feel comfortable coming back to work, if you have to, the staff member has to prove that they are feeling unsafe, and that the employer is not taking the steps that they need to. There's still a process that goes through.
Yeah,
not easy.
And Sue's brought up too that the decision on whether or not they want to share their personal, whether they've been exposed to something or have a condition maybe they don't want you to know about, that's touchy too. So that's why remember that your library employees are city employees, and as such, this is a time to be in good communication with your city about what's happening across the board for all the employees. And remember that if other part-time city employees are receiving sick time, library part-time employees should be receiving sick time. So I saw quite a bit of discussion just now about how do we keep timers on the people who come into the library. If we give them their 15 minutes, their 30 minutes, how do we know, maybe your library can have 40 people in at one time. That's your capacity, your 50% capacity. 40 people is a lot to keep track of. How do you keep them with the timer? And I had a librarian ask me that question last week, and we were talking about those little restaurant things that you get for your order. You could set that to go off in 15 minutes. Beep, beep, beep. All right, you're the one beeping. It's time for you to get out of here. I don't think that's a solution, by the way. But if you are limiting your browsing areas, that should help you be able to keep everybody in one area, and there's really no place for them to go and nothing for them to do other than to get their stuff and get out. I think that will help deter some of that timing issue.
We did show a photo from Lorenz, remember, of their social distancing their computers and removing every other chair. I've heard of libraries that plan to take a lot of their normal seating that surround tables, even lounge seating if they can move it easily, and start stashing that into the meeting rooms.
Yeah.
And so as much as you can eliminate what is normal seating to be found, make that much less available to people, then there's much less likelihood that people will stay and linger and congregate. So I like that idea too.
And if you remember that one slide we had, it was the little caption graphic, people moving the couch out of the way. That's what we said earlier in our presentation. Get rid of the stuff that's going to entice people to want to linger.
Annette has an idea here to use the blank name tags with a timestamp on it. So when they walk in, they get a time written on their name tag, and then they have to leave when their time is up.
And
this would be a possibility.
This is Angie, and I also think, again, so I've said this in the chat too. You're not going to be the perfect time police. Like, you're not going to be able to be like, I know you were here for 11 and a half minutes, and in 30 more seconds, it's going to be your 12 minutes. But that's why you have all that written out. And that's why you've thought through exactly what Bonnie said. You have all this written out and you've thought it through before you open. So you can say, you know what, you guys, I was so glad to see you and I'm so glad you're here, but you've been here 20 minutes and we're trying to limit everybody to 15. So we'll see you later. So I think that whole thing, not putting on yourself, I'm going to know exactly when you've been here 25 minutes and then I'm going to tell you to leave, but having it written down, knowing what your procedure is a huge help.
And communicating it to your public. And remember what I said earlier, don't establish policies that you can't develop a procedure for. So if you're struggling to find a procedure for it, you need to revise that policy and find some ways to fix it so that you can develop appropriate procedures.
And it's been pointed out in the chat a couple times as well, but communicate it with your staff so that your staff also feel comfortable doing this. You're not, I mean, you might have, if you're a director, you might have to be the heavy once in a while, but you need to write and enforce policies that everyone on your staff feels comfortable enforcing.
And all the more reason to start putting this to paper so that procedures are written and documented. The very first group of people that has to have a firm paper hard copy of these decisions is your staff who's coming in from day to day. Absolutely. And then you'll have a document to share with your public too.
Yeah, I also want to say I've seen a lot in the chat about, solo librarians and their concern about being able to enforce all of these things. Also solo librarians that are folks that are vulnerable and at risk themselves and concerned about opening to the public as a risk to them. And I know it's difficult, but I want to say to those solo librarians, like, don't give up, advocate for yourself. You're just as important a member of the community as anyone else. And if you're unsafe being in the library, then you need to communicate that to your board and put forth procedures and policies that protect you just as much as any patron that walks through the door.
Yeah, Cassandra, I had a director in one of my earlier sessions. I can't remember if it was a roundtable or a office hour session, but her board was really pushing her to open. And she has some health concerns and was not comfortable opening and just couldn't seem to convince her board that I don't feel this is a safe time for me to be in the building, but she's a solo librarian. And I said, definitely share that list of considerations that the state library posted. Share this video, this recording when it's available. And I said, ask your board, could you come in and volunteer? And if they're not willing to come in and volunteer, maybe that's a good reason for you not to be there either.
I don't think any of us signed up to, sorry, I don't think any of us signed up to put our lives at risk for our profession.
No, I love what you said, Cassandra. Thank you for saying that. I just wanted to ask if any of you have seen some of the questions posed to governors in their press conferences by the media. Some of those questions posed that said, so Governor, tell me, do you have plans to go to church on Sunday, followed by brunch at Perkins, followed by a stroll through your local farmer's market? And it was said sarcastically, as we have come to know what's been said sarcastically, not. But I don't know how those governors answered those questions, but this got me to thinking, what Cassandra said got me to thinking this very thing. And to advocate for yourself is like the best idea of the day right there. Thank you.
There has been some chatter, and I'm guessing this is something that a lot of folks in some parts of, well, maybe some more rural communities or places that haven't seen as high of cases, but who are saying, like, not understanding why, if this has been opened, why not the library? And getting some pushback from community members who just think, something could be open. So I'm curious to see how folks, if there's language that you have that you're using with in that setting, or if you are experiencing something similar.
We haven't had a lot of pushback yet, and I'm in Muscatine County. I'm at West Liberty, and we have a pretty high spike going on at the moment due to the meatpacking plant. Oh, I'm frozen.
No, you're fine.
Okay, good, great. So we haven't had this issue, but I happen to be quarantined at the moment. My husband had a fever on Saturday, and I'm not allowed back in the library until for 14 days after Saturday, so the 16th of May, and that seems to shut people up pretty fast.
Yeah, and I think that's something we're not really going to have a silver bullet type answer to. I mean, it's kind of the same. It's along the same vein of, well, why can't the library have this resource, or why do you have that resource that I think kids shouldn't be reading? Why? And we have, unfortunately, it's become pretty ideologicalized. Is that a word? I just made it up.
It
and
works.
so that you're going to have, there's a lot of yeah, we have grace for ourselves and we have grace for others. And I think it's going to be difficult for everyone. And we're all going through grief in different ways in this setting. So.
Yeah, and just keep in mind, as we said from the very beginning, the one thing we weren't able to do today and can't do is alleviate all of your worries. And as I said, there is no playbook on this. We really don't have many examples to follow, other than one of my directors did go back through her digitized newspapers and look to see what was happening in the city during the 1918 pandemic, which I thought was very creative on her part. But even then, some of what they did back then, it is some of what we're doing today, 100 years later. But they didn't leave us a whole lot of procedural guidelines for our libraries, unfortunately. So
you also have to update your policies more than once every 100 years, right, Bonnie?
Yes, amen to that. Yes.
Oh, okay. It's about 20 after 2, and I think again, I just want to reiterate to folks that we hope this has given you some food for thought. We are here to help. The state library is here to help. If you need an additional voice in a conversation with a board member, anything like that, I will volunteer my district friends to do that. But I think our questions are kind of wrapping up here. I think I got everything, but.
There was one, someone said, is there a way for her to be able to know how many libraries are still closed? Is the state library still keeping track of that? We are still trying to keep track of that. We're actually, you should have received an email, was that yesterday or today, asking you to give us information about your reopening. I think it's fair to say that the majority of libraries are still closed at this point in time, and or those that are reopening are doing so on very limited basis and or have phased plans. So this might be another good reason, if you're in a county that has multiple libraries, to coordinate with those other library directors at those other libraries so that you can all kind of follow similar suits, so it doesn't put you out on the limb all by yourself, whether you're opening or closing.
And where can we find the list and the status of other libraries?
Every library director was sent an email this morning, and it's also been posted on Library Talk and on the Iowa Shares site.
I know that you had it on the state library's website for some time. There was a spreadsheet.
It's there too.
And where would we find that?
On the COVID-19 page.
Okay.
Emily just shared a link in the chat.
My question is, does curbside service count as reopened?
I think that depends on if you've previously not been ordering it, or offering it rather. If this is something new, that's certainly a step toward reopening, and that you're circulating materials.
Well, and that list is there so that we can determine when we can start the delivery process again. That's really the whole purpose of it, is knowing what the status of libraries is, because we need 330 libraries open in order to even start the process of getting delivery started back up. So if you have, there is a question there, do you have someone there to receive delivery. And that's kind of really the basic question. It's not whether you're open to the public. It's more the, do you have staff in your building that are there on a regular basis?
And if your open day is your designated Iowa Shares Day, that's a good thing to keep in mind too. And I will just circle back just quickly to you, Rita, with your question about beginning curbside service had it not been offered prior to this. That's exactly what Sioux City Public Library is doing, and that's how they are considering one of the early phases of their reopening. They're going to be offering no-touch curbside service at the North Side branch only, but that's the way of kind of ushering in and kind of opening the doors to library service on a limited basis.
And that's the way we were offering curbside initially, and then we stopped, and now we're going to be again starting that back up. And so yes, it's the first phase towards, yeah.
All right, wonderful, everyone. Thank you so much.